This meeting has born for interaction, so all the people will come here, they will discuss actively during the presentations in order to make everyone like part of a big family, and there will be 3 rooms, aortic, peripheral and venous, and all the 3 rooms will run at the same time, and people can switch between one room to another one and they can have fun enjoying the conversation with clinicians, faculty and colleagues. I think the top topic for this year is going to be vessel preparation. There will be a very nice conversation between specialists about different ways to prepare the vessel, if the vessel preparation is underrated and why, and what can we do to improve the results for our patients. I mean, in some way yes, but it's not really proved to improve the clinical results. So if we talk about vessel patency, there are like signals that the vessel preparation of course is useful, but we need to have more consistency and more data in order to support this in a way expensive approach to vessel treatment. I think one of the high spots for venous is about patient referrals, because many times these patients don't even come to vascular surgery. So essentially there's a huge gap between diagnosis and treatment. And then of course treatment is still an issue, there are still many doubts. Essentially it would be a very nice conversation between specialists in order to understand what's the best treatment tailored on different patients. The young ones or the ones with recurrence of DVT, so there are different types of patients and many times these people are young. So we need to take the right decision in order to give the best long life treatment to these pathologies. So I think that aortic is going to be a good session when we are going to talk about the different options for complex patients. Complex patients and their age make the challenge of the aortic repair very difficult. The whole aorta is considered in the program, mainly of course infrarenal, which is the most common pathology in the aorta, but we're going to touch on of course on fenestration in the arch, fenestration in the abdomen, so everywhere. I think it's the indication and the management intra and post-procedural of complex fenestrations. I mean, people need to do it right the first time because it's a complex operation which can lead to potential very high risk complications in case it doesn't go well. And essentially the maintenance of this patient is also important because we need to understand what we can do to provide longer results to our complex and expensive fenestrated procedures. Today we're going to talk about Volodos. As you said, is underappreciated many times father of EVAR. Of course, I got these incredible videos and also pictures from Krasi Ivanchev, who was an interventional radiologist who worked in Malmo for many years, but he's from Bulgarian origin. So in a sort of an 80s period, he had some connection with the Russian part of the world and actually got these videos directly from the secretary of Volodos himself. So essentially we are showing how the Russian together with, of course, not only doctors, but with engineers from the aerospatial sector, developed these stent grafts, and the idea of putting like a graft reinforced by zigzag stent, which was actually developed by Gian Turco, is a very complex story, was then the start of the journey that also, of course, Parodi brought to the modern Western world, where Volodos was forgotten because of the, of course, the crisis of the Russian Empire after the wall of Berlin fell. This is what I'm going to talk about. It's not like a first and the last one. Essentially, everyone worked almost independently. I think that Gian Turco is very much, again, underrated guy because he developed this zigzag stent, which then Volodos and his team, as I said, the aeronautic spatial team, developed in a better way in order to give like a proper structure to it. And this was the first EVAR that Volodos did in 1987. Actually, this is an incredible testament then to the science, because I mean he developed the way to treat this aneurysm endovascular. But Juan Parodi didn't know about Volodos because there was no way for an Argentinian or US doctor to know about the Russian publication wrote in Cyrillic. So essentially it's a sort of a common path that both followed. Both Volodos and Parodi needs to be celebrated as founding fathers of current EVAR. Of course, they developed things independently and slightly differently, but they had the same idea. This is not something new in the world, because I mean the independent people develop the independent inventions also in other fields, and that's actually a theory which works very well for animals and for humans. So they both need to be celebrated, and today if we're talking about complex aortic stenting, it's just because of their work.